So J1 is here, and I'd like to give him the floor for the next 10 minutes or so, and let's give him a big welcome.
Thanks so much, Steve, and thanks to all of you. It's an honor to be here. I think the last time I was here, I was commenting, I was in the cheap seats over there, the obstructed view, but today there's actually some room in this main room, so it's good to see. First of all, I want to thank everybody, not just for coming today, but just for your support over these last 7 months or so. And as the board was going through its process, I had a lot of time to reflect, and I think that's what I want to talk about today. That's what you're seeing up on the screen. But the other thing I wanted to mention is just a tidbit about Janet. Steve talked about Janet's new role, and I think it's really important to talk a little bit about how that selection was made, because we had so many really strong internal nursing leader candidates for that role. But what really set Janet apart was the fact that she had not only started her career as a bedside nurse, seen the inpatient side, seen the clinic side, but also seen the health plan side and all of the programs that we have to keep people healthier. And of course, you all know Geisinger at Home, which we launched about a year ago, but also a lot of what she's done with the CHAs, a lot of what she's done with our care coordination model, the diabetes program, the medical home. And I think that was really important, because nursing at Geisinger is not just about inpatient hospital nursing. And it's because Geisinger is not just about inpatient, let's see people in the hospital, make them better, and hope that they do well otherwise. As you all know, Geisinger is inpatient, outpatient, primary care, specialty care. It is social workers. It is all of these things trying to keep people healthy, and ideally out of the hospitals and out of the ERs, and we're going to talk about that. But I think Janet embodies that full breadth of skills and full breadth of understanding what we're trying to do. And so we are thrilled to have her join us in that capacity. And so I thought it was a good opportunity to talk a little about that. Now, it doesn't mean, trust me, wow, if you saw that slate of candidates, we had some phenomenal leaders, and many who similarly have a pretty big, broad expanse of knowledge and expertise. And I think it's indicative of the kind of career options that are available within Geisinger. If you have an itch to scratch within healthcare, we got something for you. And I think, seeing these candidates come through, it was good confirmation of that. So I just wanted to start with that, but really, Steve asked me to talk a little bit about this. Oh, we got triple loaded here. But as I've been going around, a lot of folks ask me, well, what's the next chapter of Geisinger look like? And I think if you look back, we're a 104-year organization at this point, and during that history, we've done a really good job of doing the Field of Dreams model. We build it, and people have come, and they've come. They've really come, in abundance, and we've had the honor and privilege of taking care of these folks from within the community. I think as I look out into our next decade of what's the next chapter of Geisinger look like, I think it's build it and take it to the people. I think it's building programs and bringing it closer to where people are. And we'll talk about what exactly that means and some examples of that. But when we can do that, as opposed to build it and expect them to come to us, I think we do a very important thing. We make health easier. It's easier when we can do something through food than when we have to do it through medicine. It's easier when we can do something in the clinics than when something needs to be handled in the ED. It's easier when someone gets treated and discharged from the ED than when they need to get admitted to the hospital. It's easier when we can provide services in the home, whether it's mail order, Geisinger at Home, those kinds of things, than even having them come into the clinic. And of course, it's easier when we can take care of things in primary care versus having them have to go to specialty, urgent care, ED hospital, or so forth. So you get a little bit of a sense of, the kinds of things we're focusing on. Now, why are we focusing on that, and why is that so important? Well, I'll start with the bottom one first, because Steve referenced it. If you look at our patient demographic, our member demographic, our community demographic, the largest growing segment of our population are those who are 65 and older. And if you look even macro, nationwide, it turns out about 10,000 people turn 65 every day. It's the baby boomer generation. It started in 2013, 2014, somewhere around there. And the projections of the demographics say that there's probably 4 or 5 more years where that demographic of 65 and older, every year you're going to see 3% a year increase in that slice of the population. And then it kind of starts leveling off, and you'll see a handful of years where it'll be 1.5% per year growth. And that's just literally the baby boomers entering that age bracket, and then the baby boomers kind of phasing out of that age bracket, and that's what leads to that tremendous growth. So when you look at our communities, it's actually even more pronounced than that. And that makes sense because as people age, they're more likely to land in places that are a little more rural, away from the big cities, because life is a little bit easier to manage. A lot of people come back closer to home. So it presents a huge growth opportunity for us, but more importantly, if we're being responsive to the needs of our community is getting older. And so as people get older, you gotta figure out how to make health easier, because they're dealing with a lot of chronic diseases as you get older. That kind of goes hand in hand. Multiple medications they're trying to juggle. At the same time, they may even be caretakers as their children are off working and they got to help with grandkids. These are busy people, and we need to try to make health easier. 65 Forward is a great example of that. Huge growth opportunity for us, but really a big opportunity to make health easier for seniors. So that's one driver. Another driver is consumerism. I always pull out my phone when I do this, and it's because all of us have expectations around immediacy. I want to be able to get someone's opinion now. I want to be able to schedule things now. We have some catching up to do here. Community expectations around private rooms when you get admitted to the hospital. That's a good example. Some people say, wait a second, so making health easier, I get it, we want to keep people out healthy and out of the hospital. Does that mean we're not going to build any more hospital bed towers? No, we probably do need to build hospital bed towers, and it's not because that's the right model for care. It's because we still have a tremendous need. People are always going to have heart attacks. People are always going to have strokes and so forth, and they're going to need to be admitted. And now there's an emerging consumer expectation around private rooms, and we still have a significant chunk of our rooms, like many hospitals do, that are semi-private. And so over time, we want to be able to convert those, and we're setting out on that. Now, luckily, more than half of them are already converted into semi-private rooms, but as we do more of that, we're going to need more capacity. That's an example of the kinds of things we're going to need to continue to invest in, as well as things like digital or telemedicine, other ways to make health easier. The other driver is something we see day in and day out, and that's competition. We have competition all around us. I think all of us start thinking about places like UPMC or Penn or Hershey or whoever, and those are all competitors. Believe it or not, in weird ways, they're also collaborators. So this is a neat kind of dynamic where sometimes your competitor also becomes your collaborator and partner, and we have plenty of that going on, and we're going to continue to see that. But the thing I wanted to plant a seed with all of you is that competition is not even who we might think it is. Our biggest competition may in fact be CVS, because they're everywhere, and as it turns out, we send a lot of prescription volume over to CVS, and it's a lot more expensive for our members, our employees, our patients, and so forth when we send those prescriptions that way, and that's not making health easier. And so we launched our own mail order pharmacy a year and a half ago, And it doesn't get much easier than every 90 days getting a box dropped onto your doorstep with your chronic medication refill. And that's a good example of the kind of programs we have to build. We had a discussion, Steve and I were in a discussion yesterday about flu shots. I've been here now 3 years, so just about, this will be my 3rd flu cycle. And I am astounded at how difficult it is to get a flu shot here. And instead, we make it a lot easier for people to go somewhere else and get their flu shot. And then when they go somewhere else, sometimes we get a record that they got it, sometimes we don't. And then when they're employees and they get it through employee health, we have a record, but it sits in the employee health area. And then when we're trying to figure out who's actually gotten their flu shot or not, if we gave it to them in the clinic, you know, we have the medical record, the clinical record that shows it, but if they got it through employee health, it's sitting somewhere else, and if they got it at Giant or at Walmart or at CVS, we don't really have a good record of it unless we paid a claim, and then it's sitting in the claims data. We have very little ability to say what percentage of our population got flu shots. And that's important because, as it turns out, flu actually kills people, especially when they're older. And so we need to be able to understand things like that, but that's a good example of competition and making things easier. And we can make that a lot easier if we're doing it ourselves. So you're gonna see things like that. And I think what happens is, you know, as we look to make it easier because of these drivers, there are a few things that I think formulate what that strategy and vision looks like. We need to have easier points of care. And that's primary care, big expansions. You heard about the 65 forward, big expansions there that are slotted, but even in the traditional primary care model, we're on a big expansion journey. That's gonna increase access points. The other is we know we're bursting at the seams in places like the emergency room, and ideally we'd love to have capabilities where in the ER we have a separate holding area for people that don't quite need to be admitted, but they need a little more time to be managed before they can go home. Those are easier points of entry, and also points of entry that will prevent having to, you know, send someone upstairs for an admission. We need to meet people where they are, and that's the build it and take it to them. So we're building it, more points of entry, but also accommodating people's needs. We have shifting demographics. We have a lot of different languages that are being spoken, especially in the Northeast, and we know we're not keeping up with that. We gotta do that, because that makes health more difficult when you can't communicate with your healthcare team, or you can't communicate easily with your healthcare team. Now, all of this, the good news is, I actually think we're farther out ahead than a lot of our competition here locally, but it's not good enough, and so we gotta keep pressing. Education level, you know, we are very, we take it for granted. Everybody in this room, we read and write. When we read something, there's a good chance we understand it. Even Keith understands some of the stuff that gets written. But we gotta make sure that we're being attentive to our population, and sometimes that's something we have to be cognizant of. The other thing is, how do you get deeper with your relationships so that you get more mind share? Not market share, but mind share. And that means instead of just doing their specialty care, instead of just having them for cardiology, how do we make sure we also get their primary care? Or how do we make sure we're also servicing their neurology care? Instead of just having primary care, how do we make sure we're also, when they get hospitalized, they're coming here? Or instead of just seeing them when they need to be admitted, so seeing them in our hospital, how do we make sure we also can touch them in the follow-up? Now, a lot of community physicians entrust us with the care of our patients, and so we're not gonna get in the middle of that. If there's a patient, they have a good patient-physician relationship with somebody outside, that's great. But we still need to be able to touch them and stay connected with them, because that's what's gonna make health easier. When it gets fragmented and chopped up, it's awfully difficult. It also means our relationships with our vendors and our community, we have to get deeper. And so You'll see a lot of work being done around brand and marketing and so forth. You'll see community relations department kind of creeping up here that is responsible for establishing relationships with local high schools and universities, other employers, and so forth. I think that's the kind of work that we need to become more active in. And I think the biggest asset that we have is really all of you. Everybody in the Geisinger family is already plugged in many ways in their community, and being able to harness that and channel it into establishing these deep relationships, big part of what we want to do as well. Health fairs, community organizational events, you name it, we need to have a deeper presence and visibility, and so that's what we're trying to do. The other is beyond traditional healthcare. You know, our Fresh Food Pharmacy, our Geisinger at Home, our social determinants work, you know, a lot of it being led by Allison Hess, and Janet was involved in this as well. But that work also helps us to get deeper, more meaningful relationships with patients, members in our communities. Because it's not just touching them when they need health care, but it's touching them for other needs that are impacting their health, and by doing that, we can make health easier. The last point that I'll touch on is, how do you drive affordability? I think I've mentioned to this group before, I kind of think of it as a circle. Affordability allows you to have access, and access allows you to have health care. And health care drives better health, which actually drives affordability. And so we gotta get that circle going. And the good news is, I think we do a pretty good job, but we can do a hell of a lot better. And so that's another big area of our focus, because we know that as we make healthcare more affordable, then health becomes easier. If you saw a lot of the feedback letters that I get. So some people have said, well, what's changed in your job? Well, I'll tell you what's changed. In my former job as the chief medical officer, I probably got 2 or 3 patient or member feedback notes a day. I now get 10 to 15 feedback notes a day. And sometimes it's, you know, pretty basic. Sometimes it's ragingly positive. These are not all negative. It's great to get a glimpse into this stuff. But the ones that have hey, here's a constructive criticism kind of dynamic to it, most of the time it is around affordability and access. Most of the time. And so we have work to do there, but that's why we pay attention to admits per thousand, utilization, total cost of care, medical expense ratio. I mean, these are things that you all live and breathe every day, and now we're getting others to pay attention to it. The good news is we're making tremendous progress. So on our Medicare Advantage book of business, our admits per thousand, we've dropped about 15% over the last year and a half. Did anybody know that we were able to do that? Now we needed to do it. The reality is we need to drop another 15% over the next 12 to 18 months, and then another 15% after that, and I think we'll be in a decent spot. So we still have work to do, but that is huge progress. When I tell my friends at other healthcare organizations, other insurance companies, that we just took 15% off of our admits per thousand in Medicare Advantage, their jaws hit the floor, because they can't see progress like that for years, and we did that in a period of a year and a half. Amazing, amazing stuff. But why do we do that? We do that because it makes health easier when people can get treated in the clinic as opposed to getting admitted, and it makes it more affordable because admissions are the priciest thing in healthcare. And so that's another good illustration of the kind of work and focus we're going to be setting out on. But I think this one pager kind of captures it. So I thought I'd share it with all of you. You'll see us continue to tweak it a little bit, but as you look at, you know, what are going to be the things that we're focusing on and what are going to be the big investments that we make, it's going to be, you'll be able to map it back to this. And so that's, I think, what's exciting as I look forward to the next chapter of Geisinger. And again, wanted to thank everybody, but it's going to be a really, really cool ride. And so I'm looking forward to working with you all on that next chapter. So thanks so much. And if you have any questions or comments, please feel free to ping me or Steve or any of us. We're going to be out and about as we always are, and we look forward to hearing from you. Thank you.